Namaste. This is Dr. Vaishali Ashok Bhide, MD Homeopathy, and today I will be talking about menopause. So first let's see what is menopause. Menopause is defined as the end of the reproductive cycle in a female, which means that she will no longer be able to produce the eggs which are necessary for childbearing, and also that she has stopped getting her periods now. Menopause is said to be complete when a female does not get her periods for an entire 1 year at a stretch. However, there is a period prior to menopause which is called as the perimenopause. This starts when the hormone production, namely the estrogen and the progesterone, starts to drop. Perimenopause can last from 2 years to 8 years depending upon every female individually. Okay, so here although both the hormones are dropping, it is estrogen which is of the most importance here. Let us see the physiology of estrogen before we start. When a girl child is born, she has two ovaries, one on each side. These ovaries have large amount of ovarian follicles which are in the immature stage. However, when a girl child reaches puberty, these follicles come under the influence of the sex hormones, the LH and the FSH, that is a follicle stimulating hormone, and the follicles start to mature. Once she achieves menarche, that is the start of her periods, every month she is going to ovulate once. However, in the process of ovulation, lot of egg follicles will participate, but only one of them will ovulate. So at every month, she is going to lose X amount of egg follicles. So from menarche, which may be age 13, till menopause, which may be 40 plus, every month she is losing huge amount of eggs. So by the time she is reached the age of 40, there are very few egg follicles remaining in the ovaries. Here it is important to note that these egg follicles are the primary source of estrogen. They are going to produce the estrogen. So as the amount of egg follicles or the ovarian follicles have reduced, so has the amount of estrogen, and maximum symptoms are going to come because of decrease in the levels of estrogen. Here it is important to note that apart from female sex hormone function or function related to pregnancy, estrogen also does important roles like it helps in keeping the density of the bone good, and it also helps in cardiovascular health. That is, it will keep the blood vessels slightly dilated, keep the good cholesterol high and the bad cholesterol low. So let's see the disadvantages, or rather the symptoms of perimenopause. The symptoms of perimenopause are broadly divided into two types. First are the physical symptoms or the hormonal symptoms, and the second are the psychological symptoms. Of the physical symptoms, the most important is irregular periods or heavy periods. This means that she will get her periods 3 times a month, once in 3 months or once in 4 months, and when they come, the female will bleed for 15 to 20 days. This causes excess bleeding and hemoglobin loss, plus she will have mental and physical weakness. Secondly, the commonest symptoms are heat flushes or heat waves which run throughout the body several times in a day, associated with occasionally palpitation, fainting, or sweating. Third is itching of the skin or itching of the private parts, vaginal itching, that is, joint pains and muscle aches will start. Of the psychological symptoms, the commonest are irritability, which means the slightest word will offend her and she will become angry. Depressive thoughts, low self esteem, mood swings. With the depressive thoughts and low self esteem comes decreased libido. As the name suggests, menopause. So there will be a decreased sexual drive. Memory loss will start to occur. Here it is significant to note that while she remembers all the events which have happened 5 to 15 years back, she will start to forget what has recently happened yesterday or just while she was doing that work. So this is also significant. Because of this, the woman is very troubled. Menopause is smooth for a very few females. However, for most of them, they have to experience one of these difficult symptoms. Now let's talk about homeopathic treatment. However, before this, I will talk about some incidents in the OPD. Occasionally, I have females coming to me for their treatment. So let's take an example of this 37-year-old who comes to me for her psoriasis. While taking her treatment or while taking her case, we realize during the menstrual history that she has suddenly stopped menstruating at the age of 32. This usually follows a sudden catastrophic event in their life. In her case, she had lost her mother to ovarian cancer, and the next month she had stopped getting her periods. So, while during the case, we tell her that as we expect her skin symptoms to get better, even she will get her menses back because she is only 37, too young for menopause. Here, when we give medicines, as we bring the body in balance, the hormones also will come in balance, and as her psoriasis got better, she started also getting her regular periods. I always tell my female patients that our menstrual cycle is like our antivirus in the computer. It protects us from a lot of things, and we should be thankful that it stays with us for a long time. See, for example, it is important for cardiovascular health. Estrogen will keep the blood vessels slightly dilated. Hence, the amount or the percentage of heart attacks in females before the age of 50-55 is much lesser as compared to males. We rarely receive a call saying that so and so female has collapsed suddenly and died of heart attack. However, such calls are very common among male, even younger ones. So, when menopause starts or when we achieve the menopause, this advantage that our hormones have given us is lost, and we have to be more careful regarding our health. So, we see to it that we should postpone or prolong the menopause as far as possible. The aim of homeopathic treatment is not to give in hormonal pills. We do not give any external hormones. However, we help the body adapt to this changing hormonal status. We try to see that the menopause becomes smooth, it is prolonged, and it is smoothly achieved, which means she does not go through the storm of the emotion. It becomes a calm and a smooth process. So while we take the full case in detail, we take great details of the menstrual history, the symptoms they experience before the periods, during the periods, and after the periods. For example, before the periods, a certain female may have nausea, the other may have constipation, a third one may have food cravings, and so on. Similarly, there are different symptoms during the periods. One may get lower backaches, one may get headaches, other may get thigh pains. Similarly, there are different symptoms in every female after her periods. These symptoms are of utmost importance in prescription because these are her response to the female sex hormones. So, these are very important for us. After that, we also take into account the heat flushes, where they are maximally experienced, what is the time of aggravation of these heat flushes, and because one point of time in the whole day our body is at its weakest, so this is the time we take into consideration and while prescribing the medicine. Also, the low self-esteem, depression or irritability, these psychological symptoms are also taken in great detail and they are resolved with the help of medicines. Once a prescription is made, the aim, as I said, is to prolong the menopause as much as possible and make it smooth.
The book I authored, Unlocking the Boger Synoptic Key, is akin to referencing the books of 11 reliable authors at one go. If a homeopath wants to improve his or her results in practice, then this book can be a starting point and provide one with a glimpse of beautiful depth that homeopathic medicines are actually capable of achieving. I am glad to inform that the book has been published by the Deputy Chief Minister of Maharashtra, Honorable Shri Devendra Fadnavis ji, on 26th February 2024.
I am currently practicing in Dadar West Shivaji Park area. My OPD timings are afternoon 1 to evening 7 pm, Mondays, Wednesdays and Fridays at Park Polyclinic 5 Shankar Nivas Dada Saheb Rege Marg, and Tuesdays, Thursdays and Saturdays at Saplace Polyclinic, Malik Building, DV Deshpande Marg, Shivaji Park, Road number 4. You can also follow me on Instagram, YouTube and Facebook. Thank you. Stay healthy, stay blessed.